Hello, my name is Gabriel Zada. I'm professor of neurosurgery at the University of Southern California, and on behalf of the FAANS and history section, I'm honored today to present an interview with a very special legend and luminary in our field of neurological surgery, Dr. Martin Weiss. Dr. Weiss is originally from New Jersey and attended Dartmouth for his undergraduate and medical school studies. He then transferred to Cornell Medical College, where he completed his medical studies and went on to train at the University Hospitals of Cleveland under Frank Nelson. He did do some time in the military at West Point and then went on to finish his training and spent a couple years on the faculty of Case Western University, and then moved to Southern California to assume the chair role at the University of Southern California in the early to mid 1970s. As the chair of the Department of Neurological Surgery at USC, Dr. Weiss built a first-class educational training program, which has lasted in its legacy to this day, has trained decades of neurosurgeons who have gone on not only to be amazing surgeons, but to take major leadership roles across the country as chairs, program directors, even deans, and obviously in organized neurosurgery. Dr. Weiss has served countless roles in leadership positions, including president of the FAANS, president of the RRC, president of the AVNS, and so many more. He has been a pituitary surgeon, having treated over 4,200 patients with transfemoidal operations, which he began doing in the late 1960s. He's really done it all, but even beyond that, his character as a human being, as a doctor, as an educator, as a family member, is unsurpassed. And people rave about how Dr. Weiss has changed their lives. And so today I am beyond honored to sit down and have a conversation with my teacher, my mentor, and someone who I care deeply about as a family member, Dr. Marty Weiss. I hope you enjoy it. Dr. Weiss, thank you so much for your willingness to do this interview on behalf of the FAANS and for all the viewers out there. And it is my honor to be able to sit with my mentor and have a conversation about several things. So thank you in advance for doing this.
Well, thank you very much for asking me to participate in this. I'm honored to be a part of this and have had a long affiliation with the FAANS, who is truly the representative for all of us in neurosurgery.
Yes, absolutely. So I want to start going back to how you became interested in medicine and neurosurgery. If you could tell us how that evolved.
Sure. I think everybody likes to think about having an incident that got them involved with perhaps their interest in life. And as a kid, I was sick once, and I had some bad abdominal pain, and there was a visit paid to me by a physician who made a house call, as a matter of fact, in those days at my age. And I was made better by this physician. I said, wow, isn't that wonderful? I think I'd like to be a doctor. And so I knew nothing about being a doctor, but I was just impressed and awed by the skills of this physician. So I thought I'd go to medical school, and I enjoyed the sciences during my high school years, and it convinced me that's what I wanted to do. Of course, my mother was very helpful and enthusiastically encouraging me to do so also.
I bet. I can imagine. And so at Dartmouth for school, yeah. And what were your early, I guess, brushes with neuroanatomy or the brain?
Well, I think that probably what interested me in the nervous system was really my first 2 years in medical school, which were the Dartmouth Medical School. At that time, it was an interesting program. Dartmouth had a 3-2 program where you might be accepted to medical school after your third year in college, complete your first year of medical school, and then get your bachelor's degree upon that. And the medical school at that time was only a 2-year medical school because it was in a rural area. Even though Dartmouth is the fourth oldest medical school in the country, the clinical services at that time were not felt to be sufficient to carry you through all 4 years. So I spent my first 2 years at Dartmouth Medical School and was very highly influenced by Robert Fisher, who was the chairman of neurosurgery, and Henry Heil was a chairman of a department of neurosciences in the medical school. Dr. Heil was a neurosurgeon also. They were mentors of mine who strongly influenced me in my neurosurgical career. And then I transferred down to Cornell in New York City for my last 2 years of medical school. And of course, one of the giants of neurosurgery at that time was Dr. Bronson Ray. And Dr. Ray influenced me, or really cemented, I guess, my interest in neurosurgery at that time. Perhaps even with his interest in the pituitary, sponsored or fomented my interest in the pituitary, which really evolved over the period of time. Anyway, that's how I got into neurosurgery as a basic approach. Anyway.
Amazing. So Dr. Ray was someone you emulated earlier on in your career. Is that?
It's someone that I admired greatly. Russell Patterson was there also, who turned out to be a good friend of mine for many years, as was Buzz Hoff. And we had a number of people at Cornell at that time who made some contributions, certainly not more than I have, in neurosurgery. And but Dr. Ray was an inspirational person. He was, I like to say that I think he was the best technical surgeon that I had ever seen operate. He never made a second move to accomplish something. He was able to just move through a procedure as if he'd done it, and he had done it so many times, and never have to repeat himself a step. It was really watching him conduct a symphony orchestra, to watch him operate. It was a wonderful experience, and it just inspired me to carry through into neurosurgery.
So you very efficient and deliberate in the OR. It sounds like
exactly.
So I know for a period of time after medical school, you went to West Point, and you also you had some service abroad. Is that correct?
No, it was not abroad. I lived at a time when the draft was still in existence, and so and there was a physician draft also. So I, after completing a year of surgery at University Hospitals of Cleveland, I was drafted, as a matter of fact. And although I didn't want to volunteer for it, I responded and was fortunate enough to be assigned to the U.S. Army Hospital at West Point, where I worked as a junior surgeon. Where there were two of us, one from Yale and myself, who were juniors to the two senior surgeons, and spent 2 years doing general surgery. That was actually a very delightful experience for me. It was a busy service because we covered the whole area of First Army, and so I spent my 2 years at West Point, as a matter of fact, doing surgery. It's my military experience, but as I reflect upon it, it was a worthwhile experience before I returned to do my residency.
In Cleveland, to finish up in Cleveland.
Yeah, and that, of course, was what the years subsequent to that in Cleveland was what cemented, well, I already had my objective for neurosurgery cemented, but what really created a sense of what I wanted to do in life and how I wanted to proceed with my professional career in neurosurgery, because I was mentored by two people who were giants in my mind in neurosurgical education. That was the chairman at that time was Dr. Frank Nelson,
Of course.
and Dr. John Jane was on the faculty at that time.
Amazing.
And these were two people who were absolutely dedicated to resident education. They were excellent surgeons, but resident education was what they understood we were about in academic neurosurgery, as well as developing the field by investigative efforts. And they really set the tone for what my interest would be in the future. And so I always mention their names because they had probably the greatest influence on my professional career of any person I can imagine.
Yeah, and over the years I've heard you talk about Dr. Nelson. Obviously, Dr. Jane, I knew a little bit later on, but can you share a little bit more about them? Because I know how profound, but what is it that you emulated about each one, or
Well, I think the biggest thing was their absolute dedication to resident education. That was actually primary in their minds. They were self-effacing. They didn't have aspirations for great glory themselves. It wasn't about themselves. They were not egomaniacal. They were there for you as a resident, and they wanted you to succeed. Now I think, stimulated and wanted their residents to enter academics, and it's reflected in the fact that both of them were very successful at developing young neurosurgeons who went on to distinguished careers in neurosurgery. And it was just that the focus that they had on the development of residents, which is the future for us. I mean, our future is dependent upon the young people who come out and carry the torch forward. And their dedication to that stimulated my interest in what I wanted to do for the rest of my life.
Yeah, and if there's one thing, the first thing I would say about Dr. Weiss, it's that you're all about resident education and the residents. And I know that was a principle of yours. It is a principle of yours to this day, that the number one obligation of the chair of a department, even if there's a role of a program director now, which is a newer development, is the residency program. Is that correct?
Absolutely correct. In my mind, the role of a chairman is to develop the residents in his or her department or division. I see no greater objective. When I became a chairman, that was the job I wanted to have. I didn't want to be the dean or the president of a university. That was the job that I wanted to have. And it was a commitment to the development of residents. And in my mind, that is what a chairman should be doing. Once you become a chairman, in my mind, you have achieved the ultimate position in academic neurosurgery. And your job is to transmit your knowledge base and your skill to young people who will succeed you. And maybe, as has happened in my lifetime, the residents I've been privileged to work with are more prominent and highly skilled than I ever was. And I'm proud of that. I'm delighted to see that. I have no problem with that.
Well, your legacy and over the years, I mean, there are so many people that I hear to this day that say, I am in neurosurgery, or I am in academic neurosurgery, or I practice cranial neurosurgery because of Marty Weiss. And I can say for myself, the reason I'm at this program, the reason I ranked USC first was after meeting you and seeing the program that you built here since the late 1970s, I believe, early 1980s. And so, what are you most proud of in the last several decades after handing the program, to one of your colleagues and trainees, Dr. Giannata, and seeing the program continue to flourish in so many directions? What are you most proud of looking at our program today?
Well, number one, consistent with what I said, I'm proud of every resident that has graduated from the program, whether they're in academic positions or in private practice positions. All of them have made me proud of the fact that they practice a quality of neurosurgery of which I'm extremely proud. I think the other thing is that SC grew from what was, when I came here in 1973, really a regional neurosurgical program, a very strong program under Dr. Ted Kersey, but primarily training neurosurgeons who would go out into the Los Angeles community and do an excellent job taking care of patients there. But it was different from what the academic programs, mainly based on in the East, as a matter of fact, and some in the Midwest, basically, would do with respect to national, a national presence, if I might say. And so what I'm so proud about is having developed the additional faculty who have been here, some of whom who have gone on to other positions, but I'm particularly proud of the fact that we actually retained much of our faculty. We didn't have a big turnover. And then I'm absolutely thrilled with what Dr. Giannotta has done to carry the department forward. I mean, it is a premier program that is a great educational resource, a resource for research, and provides patient care that is not matched in my mind by many places in this country.
Yeah, I would agree, and I know that our trainees still seek our program out from all over the country as a place of excellence to train, I think.
Yeah, I think that's true. I think when our trainees, I don't like to talk about trainees. We educate residents. I like to, the old statement I say, you train a rat to run a maze, but you educate residents because neurosurgery, the life of a neurosurgeon is an educational process. And our former residents come back to tell us about other programs and places where they are and how they carry the imprint of our program to other places. And it makes me very proud to understand how we are respected by other programs for what we have done to enhance and develop the specialty. And that's what our job is.
Without question, yeah. In addition to education, I've always looked up to you as being the ultimate patient advocate. And I remember being your resident and you rounding in the mornings and going by to see the patients many times a day. And the way you ran a clinic is the way on my greatest day, I wish I could have rapport like that with patients and families. I've never seen anyone do it better in my life.
Well, actually, that I was taught that by Dr. Nelson.
Is that right?
We used to jokingly say, when I was a resident for Dr. Nelson, we used to say, he's the best chief resident the world has ever seen. Because Dr. Nelson would round with us twice a day, on weekends, and always focused on resident involvement with and care for patients, to understand that the patient entrusted their lives and their well-being to us, and it is a responsibility for us to restore them, if possible, to productive and enjoyable lives. And it's a reason I always say that, I hardly remember all the triumphs of my life, but I remember all the tragedies. And it's because it's patients that you live with and are part of your lives, and it's as if a patient is a part of your family. And they come to you with that hope. And when we deal with the nervous system, particularly in cranial surgery, there's not a major margin for error.
It's unforgiving.
It is truly unforgiving, and what we have to do is be focused on what we do for the patient and decide what is best in patient's interest. There's no question that is a responsibility as a physician.
Absolutely.
Yeah, no question.
I learned that from you. The day I interviewed here, you came out to the group of medical students. You may not remember this. And you said, well, we don't just train technician neurosurgeons here. We train doctors. And from your first day in this program, you will learn to take ownership of people's lives. And that message has been so resounding from you. Can you talk about what it has meant to you personally to have a life and a career not just as a neurosurgeon, but as a physician. And do you have any reflections about that?
It makes me think back to my father-in-law. My father-in-law was a family physician, and he was a family practitioner in our area of Newark, New Jersey, where I grew up, and was a beloved individual. I remember at his memorial service, there was a packed auditorium. And it was because he was so respected in the community for what he had done to help people return to good health. And it's what I thought. It's why I wanted to be a doctor. And as I talk about being a kid, as wanting to be a doctor, to help people get better. Now, we focus in neurosurgery, but that's what our job is, to help people get back to in being able to enjoy their lives. They don't come to me because they love me or they feel I'm extra special. What they come to me to do, or they did come to me to do, is basically help them get back to their own lives, and that's what our job. And you have to take ownership of that. And I take pride of it, and I'm still proud of, as I'm sure is true of so many neurosurgeons, to have patients send me emails 20 and 30 years after surgery, and just expressing their appreciation. It's a very gratifying experience.
Well, I still see many of your patients in follow-up, even years or decades later, and they always ask me to send regards to you and ask about you.
Well, that's kind.
There's many people out there who are indebted to you, and you may not admit it, but
well, that's
it is
our job.
true.
That's our job.
That's our job.
Really
that is our job. Even for all the glory that neurosurgery brings with it, and what an amazing career it is, there are challenges, and I know our medicine is evolving very rapidly, and outside of being a surgeon and an academician, etc., you've managed to really balance life really well. I feel like you're a family man. You've raised 3 children. You have grandchildren. I know you and Deb have enjoyed fishing over the years, and would go to Montana a lot, etc. Can you talk a little about what has kept you balanced over the years? What has kept you grounded, and also in this state of evolution, do you have any advice for young doctors or neurosurgeons out there?
Well, first of all, with respect to family life, respect your family life, and having a good mate, having a wonderful mate is a very critical component. Debbie was instrumental in being not only a mother, but being a major factor in the lives of my children, who are very dear to me, and she's beloved by them and as well as by my grandchildren. And that's always helpful to have that type of support, and to feel that you are a part of something that's personal and loving at the time. Now, as far as our residents are concerned, they're like my family. They really are, and I still talk with residents with some frequency, as a matter of fact, and enjoy chatting with them, and sometimes being of help even at this stage in their life and my life, as a matter of fact.
Not sometimes. I know that our residents, when you go to clinic at the county hospital, which is so generous of you with your time, they are so lucky to have not just an experienced neurosurgeon and former president of the FAANS, et cetera, but someone who's willing to sit there and teach them and go through these sometimes advanced cases. They're very fortunate, and I think they know that.
Well, I consider it a privilege to be able to do that. I love to see it. I am so confident in the future of neurosurgery, because the quality of people that come through our program is extraordinary. And I'm sure this is true of many programs in the country. We are generating an extraordinary group of young neurosurgeons who will propel the discipline. I think neurosurgery is in good hands for the future because of the people who are coming through, what they're able to do, and what they do, as a matter of fact, early on in their careers. They really represent this.
It's a pretty dynamic, amazing group, isn't it?
There's no question about it. And what I'm very pleased about is that the scope of neurosurgery has expanded so much. When I think about my era of training, when, it really was crude compared to what is done technologically now, but also the understanding that we have of disease processes, pathophysiologically, genetically, the technical instrumentation that has evolved over time. All of this has enabled us to venture into areas in the management of neurological disease that never existed historically. And I am very confident in the future of neurosurgery because I think a number of the areas of neurosurgery that are really in their infancy now, particularly in areas of functional neurosurgery, I believe that we're going to be involved with the management of degenerative diseases of the nervous system, stroke in a much more extensive way than we already are involved with. And the numbers of patients in this country who suffer from these diseases is extraordinary. And I think it is a field or it is a community that will allow neurosurgery to thrive. I don't see medical management of processes diminishing. I only see an expansion in the role of neurosurgery in all of these diseases.
Yeah, and there's going to be a lot of evolution, and it seems like Moore's law. Things are exponentially taking off in what we do.
Yeah. We're all microchips, is that right?
It feels that way sometimes, but no. I want to ask you, as we start to wrap up here, what has organized neurosurgery and the AANS, but also what is the journal meant to you? You served a prominent role in the Journal of Neurosurgery and obviously in developing and coming up with the idea of neurosurgical focus, which was one of the first open access journals. Can you talk about what that has meant to you in your life and career?
Well, it's meant an extraordinary amount. It's just been an extraordinary experience for me. First of all, it's been a privilege for me to serve in those capacities. I think of that as a privilege. It was my responsibility, but I was allowed to be able to do so, and I'm always grateful for that. But, as I said, that we don't train neurosurgeons. We educate them, and we help to educate them. I've always said to the graduating residents that if they practice neurosurgery 20 years hence from the way I practiced neurosurgery at the time of their graduation, I will have failed them because of the fact that they have to grow. And growth occurs not only in their own practice, but in learning about the evolution of our understanding of the complexities of the nervous system, of technology that advances our capacity, and management strategies for patients with neurological disease. Now, the Journal of Neurosurgery, which of course is the world's preeminent, the oldest and the world's preeminent journal, is a work experience, and you know that. You're a chairman of the editorial board there. That is a job, and it's a number of years of working every day, reading manuscripts. First of all, that's a learning experience. I learned so much as a member of the editorial board. Absolutely. It is a great learning experience, but it's also a work experience because you have to fairly review. Your job is to truly be a peer reviewer and to make sure that anything that comes into that journal represents the highest standards of educating neurosurgeons throughout the world, because that is the reference base for it. Excuse me. The reason for neurosurgical focus was the fact that when I finished on the editorial board, Dr. Jane was the editor of the journal, and we discussed at that time the fact that there ought to be a presence online for people to have access to this. And so many people now do their reading online and don't read a hard printed copy. But the purpose of Focus was to become essentially a textbook, because the way it's structured is so that it's topically based, and each topic each month is the equivalent of a chapter in a textbook. And over a period of 3 years or so, we thought we would cover all the areas of a textbook and then start again with a new textbook. And the problem with textbooks, and I've been involved with their publication, is by the time you recruit somebody to write an article, it goes through all the process of publication. It's usually about 2 or 3 years out of date because the field is expanding so much. And online publication gives us such rapid publication to bring things up to date. So it's important, it's critical for us to read, and I try to read the journals completely each month, just to reinforce what we know and to expand upon what we know. And if we don't have that, we're not going to advance, and that would be deadly.
Yeah, the self-learning. I mean, you not only cite papers going back decades from the Journal of Neurosurgery, but from the New England Journal and JAMA and all. And it's always been amazing to me that you can keep up on all these specialties.
Well, I have a lot more time to do that now, as a matter of fact.
Fair enough. But the journal really is a badge of honor, and to be part of the Journal of Neurosurgery.
It is no question, and I would say that Jim Rutka and Bill Caldwell have done spectacular jobs in advancing the journal beyond what it was, and that's of course true. Each generation should be better than the previous generation, and we should, those of us who represent the previous generation, we should be proud and delighted to see that. It's not a threat to us, it's a delight for us to see what people have done to advance the discipline.
Absolutely. So as we wrap up here, is there any other advice you'd like to give the learners or the trainees or the people watching this, whoever they may be, about neurosurgery or anything else?
Well, let me just tell you, the sum and substance of my own behavior is, I used to tell patients when people would talk to me about being a neurosurgeon and how special it is, and for all of you who are neurosurgeons, you are special. There's no question, but I always said that I wake up every morning and I pick my legs up one at a time to put my pants on. No different from any other person who is providing a service, number one. We are providing a service, and also hoping to advance a discipline as we all need to do. A little humility was good for me. I probably needed a lot of humility, basically. But in understanding that we're part of a spectrum and we're part of a community, and if we do our best to contribute to that community, we'll have a very satisfying experience in life, and our life will be meaningful.
Truer words have never been spoken, and again, on behalf of not only myself but definitely me, the many people that you have trained, have educated, who are now in leadership positions, who are now out there taking care of patients, doing science, writing, whatever it is, the innumerable number of patients that you've treated. I mean, as a pituitary surgeon, you've done over 4,200 just of those cases. And I cannot thank you enough for everything you've given me and everybody else. And you've touched my life and changed it in innumerable ways. And I want you to know that.
Well, Gab, I've always said you make me look very good. I'm so proud of what you have done. Your beautiful wife, Raquel, your children to be, right? One and one on the way. But you have truly contributed to to the joys of my years in neurosurgery. I want you to know that.
Thank you, sir. Thank you very
Yeah.
much, and much more to come. And
We hope so.
yeah, and thank you for everything, and thank you for your time today in speaking about your experiences and legacy.
It's my pleasure, and I just wish everyone many years of good health.
As do I, and I feel like we could talk for hours like this. But to save everyone else out there, we'll call it a day. So
Okay.
thank you, Dr. Weiss.
You're welcome. My pleasure. Thanks, Gabe.